Hello, so in this video we'll be looking at ectopic pregnancy and the danger signs of ectopic pregnancy. Okay, you know, ectopic pregnancy happens when the fertilized egg did not plant in the womb but plant outside the womb, probably the fallopian tube. Maybe during the time of traveling to the womb it got stuck in the tube. This is ectopic pregnancy, and when this ectopic pregnancy occur, the pregnancy cannot continue normally, you understand, and it poses a danger, it poses a risk to the person. So this is why it is important for you to be aware of this ectopic pregnancy and the danger signs of ectopic pregnancy. Okay, so the causes of this ectopic pregnancy is when there is an infection, maybe an infection that infection of the tube, infection that have caused a scare in the tube. This can get the egg stuck, and also if you have had previous ectopic pregnancy, it can also cause it. Then tuber surgery can leave a scar in the tube. This will also cause ectopic pregnancy. And then if you're on a fertility treatment, people on fertility treatment, they have the high chances of having this ectopic pregnancy. So it is important to note the danger signs of this ectopic pregnancy and get yourself treated on time to avoid the complications of this ectopic pregnancy. Which one of it is rupture of the fallopian tube, and then maybe difficulty in getting pregnancy again, maybe secondary infertility. All right, so the danger signs of this ectopic pregnancy is sharp pain in the abdomen. Watch out for this. Okay, and then there will be VG bleeding. This time around it's not going to look like the normal period, you know. It's not going to look like you're having a miscarriage. No, it's going to look like dark brown in color, and this VG bleeding comes and goes, especially if you have tested yourself and you have tested positive and you started seeing dark brownish discharge. It could be ectopic pregnancy. Watch out for it. And then you have a shoulder tip pain. This is very important for you to note this, because this is a sign of internal bleeding. So at any point in time you are having a shoulder tip pain, it's a sign of ectopic pregnancy. Then if you are feeling fainting and dizzy, please, you will need to go to the hospital. Don't take it as a normal sign of pregnancy, and you understand. So you have to rush yourself to the hospital for proper treatment and management. And then if you're on a fertility treatment, please, you have to, if you're on a fertility treatment, you have to also be very mindful of this ectopic pregnancy. And then if you are the type that smoke, please also be watchful of this ectopic pregnancy, so that if you see any of these signs, you can act as fast as possible in order to save yourself. All right, okay, thank you for watching this video. If it is helpful, share to others. Okay, and keep inviting your friends to this page. And thank you for staying here with me. Stay positive, stay active, and stay healthy. See you next time in my next video. Bye. Few things you need to avoid during pregnancy and why. And this video is part 1. We are coming to give you more of the things you need to avoid during pregnancy. And some of the things I'm about to mention now, you have heard it elsewhere. This is to tell you how important it is that we'll keep on emphasizing on this. So these are the things you need to avoid during pregnancy. Number 1 is smoking. Yes, thank God from our part of the world, women don't normally smoke. But for the few that smoke, please, you need to avoid smoking during pregnancy, and this is why. So smoking has some effects in pregnancy. Smoking can cause stillbirth, low birth weight. You know, it can cause baby having a congenital heart defect, and smoking can also increase the risk of birth defect and slow growth and development. That is, there will be a growth restriction. Then smoking can cause what we call placenta abrasion. That is when the placenta abnormally separates from the walls of the uterus. This is what smoking can cause, and it can also increase the risk of having miscarriage. Then number 2 is drinking alcohol. Please avoid alcohol consumption during pregnancy. This is because alcohol consumption during pregnancy can lead to you having premature labor. It can also cause developmental disabilities. There will be physical disabilities as well. It can cause abnormal reflexes in newborn. There will be inconsolable crying, sleeplessness, and all of that. So please avoid alcohol during pregnancy. I know some people thought that taking alcohol during pregnancy will help their milk production. No. So avoid the alcohol consumption during pregnancy. So number 3 is taking unprescribed drugs or self-medication. Please avoid self-medication or taking unprescribed drug during pregnancy, because unprescribed drug during pregnancy can interfere with normal development of your baby. You understand? So and then because some drug can have adverse effects on your fetus without you realize it, can interfere with their development and all of that, especially when you take unprescribed drug during the first trimester. For some people, it can even cause them to have miscarriage. Some drugs can also damage baby's organ. It can lead to baby having, when it interferes with the development of the fetus, it can lead that fetus to having some congenital abnormalities. Some drug has effect on placenta, which can put your baby's or your fetus life at risk. Then number 3 is avoid carrying heavy load or heavy objects. Objects during pregnancy can make you to have injury and then put you at risk of falling. Maybe you can even fall with your stomach and have placenta abruptio as well. There will be increased back pain. You keep on complaining of back pain, and then there will be increased miscarriage. So number 4 is reduce or avoid caffeine consumption. If you are the type that take caffeine tea because you don't want to add weight during pregnancy, or you don't want your baby to add too much weight, so please, you may need to stop taking caffeine during pregnancy, because large amounts of caffeine you consume during pregnancy will increase the risk of miscarriage. It can also increase the risk of you having a low birth weight baby, and then your baby might come up with a birth defect. There might be indigestion for you, heartburn, and increased risk of having high blood pressure. So please try as much as possible to avoid this during pregnancy. Have a healthy pregnancy and a healthy delivery. Thank you. See you next time in my next video. Keep sharing our videos and keep inviting your friends. Bye for now. Hello. So, excessive saliva during pregnancy or excessive salivation during pregnancy is quite common, mostly in early pregnancy, first trimester. So after the first trimester, it tends to reduce or stop in some women. But if it doesn't stop and is so excessive that you are getting worried, you can talk to your doctor, because too much salivation during pregnancy can lead to electrolyte imbalance. Yes, you had that right. So if you want to talk about the causes of this excessive saliva during pregnancy, I know you're already mentioning estrogen and progesterone, right? But it's not always estrogen and progesterone, though these are the two main culprits here. Yes, elevated level of estrogen and progesterone can affect the salivary gland and then leading to this excessive salivation. But the hormones are not only to be blamed here. Psychological factor also plays a role. Maybe you can't wait to get pregnant, you are anxious, you are stressed, you're having anxiety, will I have excessive saliva like the other woman, or you see your neighbor spitting everywhere during pregnancy, and then you can't wait to be pregnant and experience it. So it plays a role. Once you are pregnant, you tend to start having excessive saliva because psychologically you have built yourself for it. Increased blood flow to oral cavity also plays a role in this excessive saliva during pregnancy. During pregnancy, there is increased blood supply to part of our body, so oral cavity is not left out. So increased blood flow to oral cavity will contribute to this excessive saliva. If you're experiencing this excessive saliva, you only have to manage it until it reduces or until it stops. Sometimes in some women, the only cure is delivery. You deliver and you are free. You understand? So, but there are some tips that can help you to manage it, like sucking on ice, and help to soothe your mouth and probably reduce the rate of spitting. Okay, some people also find soothing when they use a minty mouthwash. This helps them to, give them that minty taste in their mouth and tends to reduce the excessive saliva. Then brushing often. Some women they find a solution by always brushing their mouth using minty toothbrush. This helps them as well. It helps them to keep some saliva, hold some saliva down. You understand? Instead of spitting and spitting, just make your mouth fresh. After all, it's advisable to have good oral hygiene during pregnancy. So brushing often during pregnancy is advisable, and so it will also help you to reduce the rate you spit. Another thing you need to also do, like, you don't even need anyone to ask you to do this or tell you to do this, is carrying a tissue, towel, just a little bag, or men will find a container and pour sand into it and carry it around wherever they are. Always carry your container or whatever you want to use to spit in. Carry it around the house. All right, we're going out, get a thick handkerchief and carry it around to spit on it. And as you're spitting, make sure you are drinking enough water. All right, eating sour food can also help some women. So find out the food you can eat that will help you to hold down the spit. Don't eat food that will cause you nausea and vomiting, okay? Because nausea and vomiting also goes together with this excessive saliva. All right, thank you for watching my video. Please make sure you share my video to others. Thank you for the follow and keep supporting us here. See you next time in my next video. Stay active, stay healthy, and stay positive. Do you know that during pregnancy, not all women will experience morning sickness? Yes. Some people don't experience morning sickness, and it doesn't mean that something is wrong with their pregnancy or something is wrong with their baby. In fact, this set of women, I tag them lucky. And I'm one of them. We don't experience morning sickness from first week to 37th week or 40 weeks. No morning sickness at all. And this morning sickness is caused by hormone HCG and estrogen. So fluctuation in this hormone tends to make some women experience this morning sickness. Our body is wired differently. So some people during this hormonal shift, they don't feel nausea, they don't feel vomiting, they are just fine. So, and this morning sickness again is believed to be due to blood sugar fluctuation, maybe due to a low blood sugar level, and those with a high blood pressure changes, like high blood pressure issue. This tends to provocate this morning sickness. And this morning sickness, just like the name morning sickness, does not mean that it occurs only in the morning. It can occur at any time of the day, but most people during pregnancy experience this morning sickness because it is one of the signs of pregnancy. But if you don't experience it, you're still fine. There's nothing wrong with you. Yes. So if you're experiencing morning sickness, or somebody you know is experiencing morning sickness, in this video I'm just gonna be giving us tips to help alleviate this morning sickness. Okay, so if someone you know is experiencing morning sickness, there are several strategies that may help them, such as eating small frequent meals, avoiding spicy or fatty food, please, and staying hydrated. Okay, but if you are having severe form of morning sickness, which we call hyperemesis gravidarum, then you'll be needing a medical attention, please. So there are some food that can also help you to soothe this morning sickness, and also help to soothe the stomach and reduce the nausea. Food like ginger, it is believed to have anti-nausea properties. So ginger can help if you consume a tea made with ginger, or ginger tea. So ginger tea can help you because it is known to have anti-nausea property. So this can also help you, but take in moderation. Don't take it too much. Then cracker biscuits or salty cracker, this can also help you. Eating a few cracker before getting out of bed can help you, can help to settle your stomach. All right. So and lemon can help some women, but it's not about consuming lemon. It's about you can try like lemon water, lemon drops, or even just sniffing a lemon. To some people it helps them, it give them this relief. You understand? Some people, the scent and taste of lemon in their mouth can give them this refreshing and help them to reduce nausea. So don't just consume raw lemon, but lemon water, or maybe sniffing the scent of lemon. This helps some women. All right.